Hello, Healthy Mom University. Thank you so much for listening in today. I have an awesome guest for you guys today. It's going to be so fun. I have Atalie Mayer here. She is an acupuncturist. She owns Changing Elements Acupuncture in Indialantic, and she's going to be talking to us today about women's health and a little bit about pregnancy and breastfeeding. And she is actually expecting a little one herself. She's 27 weeks pregnant, so she knows firsthand, if you're pregnant and you're listening in, she knows firsthand what you're going through. So we're super excited to have you here today, Atalie. Thank you so much.
Thank you. I'm excited too.
So our first question is, first of all, tell us about yourself and how you decided to practice in the field of acupuncture.
Yeah, so I was doing ABA therapy. So I was working with autistic kids for the Wisconsin Early Autism Project in Wisconsin. And I was really loving it, but you had to travel around to everybody's houses to do like the therapy. And getting stuck in the snow was getting old. And so I kind of started looking at other things to do. Was gonna be a special ed teacher, got into a program, and at the very last minute, the program lost funding. And so like while all that was happening, I had a shoulder injury. I have a torn labrum. And so I had tried everything from a labrum. I went to PT, I went to the doctor, I had an MRI, I got shots, whatever. And it just still was bothering me. And so eventually I tried acupuncture and I was just sold. I mean, I felt better, like on so many different levels. My shoulder felt better, but even after my shoulder got better, I still went once a week for, I don't even know how long, because I felt better emotionally, physically, my digestion was better. I slept better, just everything felt better. So then I started researching acupuncture, and I kept telling people if I didn't like special ed, I was just going to go be an acupuncturist. So when the program got canceled, I immediately applied to like a bunch of different acupuncture programs, got accepted, went and visited a bunch, and ended up moving to Texas, to Austin, to go to school it's called AOMA, the Graduate School of Integrative Medicine. But I ended up moving there in like a really short period of time, because like the classes were starting right away. And it was like the quickest decision I've ever made in my entire life, but also the easiest. So that is how I found acupuncture.
So you knew that that was going to be the lifetime career for you.
It just felt right. It just felt like, I don't know, it felt like everything was lining up for me to get there. And like, we even had a rummage sale to buy me a plane ticket to get there. And I made just enough money for the ticket. Like, I don't know, just like beautiful, like, you know, coincidences, or the universe, or God, or whatever you want to call it, you know, all that stuff just seemed to be like, yes, hello, this is what you should
to be.
So,
now, were you married at the time?
I was not. I met my husband, Michael, at the community college in Austin, because I was taking a pharmacology, and I was taking 2 classes there, and I met him, pathophysiology and pharmacology. I met him in pathophysiology. And I remember walking in, because, you know, it's a community school, so everybody there is younger, and I already had my undergrad degree, worked for a little while, and so I was definitely older. And I remember walking into the room and seeing him right away. And he, I just assumed he was younger, because everybody was. I mean, there were some that were like me, but I thought he was younger. And after the first exam, he was wearing a crew shirt, and I rode in college. And so I asked him about it, and like, that was it. Like, I don't know, also a really easy, like, relationship, you know, like it was like meant to be somehow too. And then I found out he's actually older than me. So then I felt even better. So. But no,
wow, yeah, that sounds like a match made in college.
Yeah, if I hadn't moved there, I would not have met him. And then his parents live here, so then I finished school, worked in San Antonio for a few years, and he ended up switching what he was doing and decided to become an engineer, mechanical engineer. So he finished school, and then when he finished, we moved to Florida to be close to his parents. So that's here.
Okay, and so how long since when did you open up your practice here in Indialantic, Florida?
July was when I first opened it. So, it's been slow going, and like, you know, to kind of get everything in order and just figure everything out. And I have, been getting so much help.
And then COVID.
Sure, that it's been crazy. Yes. Then COVID comes along, and I was actually starting to feel really good about things and like had a plan because I was gonna have the baby and like, you know, like things are going well. And yes, then we came to COVID, and now I'm, you know, now I'm at home.
You're isolated like the rest of us.
Like the rest of us, which is fine. It is what it is.
Yeah, exactly. Well, I'm sure you can offer us some good tips on how to kind of cope with the stresses of being isolated, especially for those of us who have children. So, but we'll get to that in a little bit. My next question is, I want you to kind of talk a little bit about the history of acupuncture, because there may be some listeners that really aren't familiar with its roots or how it came to be as an integrative type of medicine.
Yeah, I mean, so pretty much both acupuncture and herbs were about 3,000 years ago-ish. There's like acupuncture, there's maybe some more like hints like in like the New Stone Age, which was kind of like more like 10 to 4,000 years ago. But acupuncture was first used with stones. They called them beyond stones, and they weren't actually, well, they did do bloodletting, but they weren't actually puncturing like needles are today. But they would press with the stones into points. And it kind of evolved. They used stones, then they used bronze, then they used gold and silver. So everything kind of evolved over time. But I think about, it was 3,000 years ago, they had hieroglyphics of acupuncture and moxa. And moxa is like mugwort that you burn. It comes in different forms. You can kind of, you maybe you've seen pictures of like needles that have something on them and they're burning, there's smoke coming from them. It helps with a whole bunch of things like arthritis and damp conditions, and it can help with circulation. It helps with a lot of different things. But so they have like tortoise shells that have stuff on them showing acupuncture and moxa and stuff like that. And like it just kind of kept growing. And I think around that time is when they started finding evidence that there was like that the Chinese medicine, like traditional Chinese medicine, that there was a theory that started to develop from it, like the yin, the yang, you know, they use qi and blood. Like I said, we have kind of different terms, but all those things, that theory kind of started. And it kind of just kept growing and growing, and it spread to like Korea and Japan. And like, I want to say maybe France was one of the first places over that got kind of into it. And then, I think it was like 1911-ish, Western medicine kind of came in, and in 1914, they were like, no more acupuncture. Like, we need to do this the Western way. And they actually like banned traditional Chinese medicine for a while. So at that point, more rural places were still using it because, you know, there's a lot of people that have to like walk or get transportation for days to get to a hospital or a doctor. So lots of people in rural places were still using it. So it was kind of still kept alive, but not taught. And it was, you know, you weren't supposed to be doing it. So I think until like 1944, 45, everything changed again, and they decided to bring it back, and they started doing more research about it to see like whether or not it was kind of like something that could be evidence-based. And after that, it kind of like blossomed again in China. And like, I think they started training programs again in 1948. And then in the 70s is when Nixon went over to China, and he witnessed somebody doing acupuncture anesthesia. And so that, when he came back and talked about it, that was kind of when it started to become popular here in the United States. So like definitely some of its stuff had been here and everywhere along the way, but that was when it became big and people started, you know, classes and learning and stuff like that here. So herbs are kind of the same. Like they definitely go hand in hand. Like the first like case studies and records of herbs are about that same time when acupuncture when the acupuncture makta was started. But you know, what was it? I looked it up. It said about 3,000 years ago, they found some case studies. And then 2,000 years ago, they actually found some of our big herbal, like, texts that we use to learn from. And so that was basically texts that showed that they were using the same like elements of Chinese medicine that like acupuncture was, and they had toxicities and dosages and case studies and like herbal formulas, and like it just kept growing. I mean, the first one they have that they list is like 365 herbs, and today there's like more than 11,000. So, so yeah, that's
really interesting. How does herbal medicine sort of relate to Ayurvedic medicine?
So I don't know a ton about Ayurvedic medicine, but I had a friend who was really into it in school, and they definitely overlap, but I feel like a lot of the herbal systems do. You know, there's some herbs that overlap. A lot of the time is I feel like it's just the way we talk about herbs that's different, like the properties that we assign to them, like maybe we call it something else, like what they have like vata and is it kapha?
Yes.
Yeah, all that stuff, you know. And so like you can kind of relate that to like some, you know, Chinese medicine, like symptoms or herbs or like, you know, things like yeah, like I guess symptoms probably would be the best, you know, so you can relate things like that and like work them together. Yeah, they all
so like in Ayurvedic, and I'm not an expert in Ayurvedic, but I have dipped in some because I'm fascinated by Chinese and Indian medicine. And the constitution, like you were talking about, the kapha and the vata, does Chinese herbal medicine have something similar to like the different constitutions that a person can sort of be born with naturally?
So you would have kind of, I don't think we don't describe them like as specific, like you wouldn't get put into like one category, right? It would be like constitutionally you have a blood deficiency and you have some dampness, right? So like there would be based on like what you were showing, because like, you know, it's about treating the root and like the root and the stem, right? So like, you know, like the root kind of ends up being more of where your constitution is and like maybe what weaknesses you might have, right? And then once you figure that out, that can help you make sure that you don't have any more branch problems, or, you know. So
gotcha. Okay.
Not entirely, but like the things that I think would define some of those constitutions are things that we focus on too, right? Like, because I remember it being like, some of them was like how you would think, and I want to say that dampness was a part of one of them too when she was talking about it, but maybe I'm mixing that up. But
yeah,
so not entirely the same, but
that was kind of an off question. I hadn't put that in my list of questions for you, so you answered it great for being off the cuff like that. But it just popped into my head. I was curious if the two were associated in any way, because a lot of the herbs are, you know, even though they do have different names, they're kind of used for a lot of the similar stuff, right?
Yeah. So it's funny, like they're used for similar things and then they're not used for similar things. Like barley as a galactagogue for well, I guess I don't know, Western. I don't even know where it comes from, like, you know, how we use it. But in Chinese medicine, if you take it in small amounts, it can help promote lactation because it helps with digestion. But if you want to wean, you would give somebody large amounts of it because it actually like disperses qi in blood, so it can help like reduce the flow. So there's like some differences too. It's like they're always like similar, but then there's like just slight
variations.
Yeah.
Okay. So on the topic of qi, can you define what qi is for our listeners in case they're not familiar with that?
Yeah, I mean, chi is energy. So, I mean, the best way that I actually kind of usually tell people to feel chi is, I don't know if you've ever gone running and, or like you were really active for a while and then you sat down probably too soon. You didn't cool down and you can feel like the blood and stuff moving in your legs or your arms or something like that. Do you know what, have you felt that feeling before? And
Yeah.
like that's the sensation of chi. That's a chi. So chi is just energy moving through your body. I mean, we know there's energy in our body, like scientifically we know it's there, but you know, and it helps move your blood, it helps circulation. It's, you know, it's kind of like the life force. So like if you run out of energy, you're not gonna be alive. So
So in acupuncture, then, if you have blockages in your energy flows, then how would you come in? Like, if, let's say, for example, I come to you and I'll give you an example. So I saw an acupuncturist when I was pregnant with my son, and he was breech. So he was flipped, you know, he was kind of feet first, right?
yeah.
And so I went to an acupuncturist. So can you kind of like walk us through, you know, how acupuncture could play a role in helping move that energy so that the baby could right itself, right him?
Yeah, so I mean, there's specific protocols that they use for that. Like, did they have you do moxa with
Yes.
right? So like there's certain things like for that, most people would probably use the same points and do the same thing. It it really just does depend on kind of your constitution and what you're presenting with in that moment. So like, you know, if somebody comes in and, you know, they're really low energy and you start talking to them and you realize that there's a deficiency, you can use points and herbs to help tonify them. So like if you don't have enough chi or blood, it can't move, right? So, and then the converse happens. If there's an excess and there's too much, it can cause a blockage in its own right. And so then you would focus on reducing or and moving. I mean, most of the time you're usually trying to move. So you can also just have a stagnation where like something has happened, emotional, physical, whatever it is, and it's stopping the flow somehow. And so you really, they don't have an excess or deficiency. Things are just stopped. And so you just focus on moving. So it really does depend on what is going on in that particular person. So like, that's why when you go to an acupuncturist, they're like, let me look at your tongue, let me feel your pulse. Like, let me, you know, we talk about everything. Like people don't like it, but we talk about bowel movements. We talk about, you know, like nothing is off the table. So, but all that stuff just gives us information to be able to figure out like what exactly is going on so that we can figure out where there's a blockage in what channel, because there's 12 regular channels, and so there's a lot of options. There's a lot of things that could be going on. So yeah, it just kind of depends on the person. So there's not a lot of things that have specific protocols that we use, but I think like fertility treatments, turning a baby, there's more specific protocols, and I think it's more because people are always worried, especially when you're giving birth, and like nobody wants you to take Chinese herbs, especially your medical doctors, while you're pregnant. Like, it's just like, are you taking herbs? No, you shouldn't be taking herbs. So, and there are plenty of herbs that are safe, but you know, if somebody's doing a fertility treatment and spending tons of money, like, you know, you don't want to be that person that gets blamed if something goes wrong, because you're you're an easy target in that respect. So like there are some protocols that have been studied, like, yeah, like fertility, there's more than one protocol that people use, but there's like studies so that you go in right before you get implanted, and then you go in like either a couple hours later or the next day, and there's like specific points that they use that are supposed to just like help. There's some cool things, and like for turning the baby, there's different points, and moxa is almost always used for turning the baby. And then there's even a protocol for, which I'm kind of excited about, starting at week 36, there's a protocol that's supposed to help like just prepare you for birth, like, you know, prepare your pelvis and, you know, help things, you know, open. And you're supposed to do it once a week, basically until you give birth. And like, as you get further along, there's like more points you can add to it basically, but I'm kind of excited to do that for myself too.
Yeah.
And I mean, and it's fun. There's points that you can use to help induce labor, or there's points that you can use if you stall out. Like, there's just so many different ways it can be used. So
that's amazing.
It's fun.
So when you're talking about like the energy lines, I've also heard it called the meridians.
Yep.
Is that okay?
Doesn't matter.
So there's 12 meridian lines in the body. And then are there lines that branch out from those meridians as well?
So yes, there's 12 regular channels. Then there's 8 extraordinary channels, which tend to borrow points from all the regular channels. So, but then off of the 12 regular channels, there are like there's connecting channels that go from there too. Yes. So there's so many points. There's so many options. But yeah, there's tons of things that branch off for them, really, basically. So
it's really, the human body is just so incredible.
Yeah.
You know?
So what's interesting is the channels, they go, up and down throughout your body, right? Like your lung channel starts here and kind of goes down your arm, basically. But the points that we use are the points on the body where like we can access the chi, but a lot of the channels actually go to more places than that. So like my lung channel starts here, but it goes into my lungs. That's why it's called the lung channel. And like your liver channel, there's really no points that go up through your chest, but it's a huge channel to use when you're treating like breast things. So it goes through there, but there's not really a specific liver point that's like right there, but the channel goes there. So you can use a different point where, you can access the chi and use that to treat that channel too. So even if you like learn where all the channels are like on the body, like they still go more than
to other areas, to deeper areas.
Right.
Okay. So it's really interesting when you were talking about acupuncture and infertility, because I was getting acupuncture done when I got pregnant with my daughter. And the acupuncturist was the first person who knew that I was pregnant because when he checked my heartbeat, my heart rate on my wrist, and I remember he didn't tell me flat out I was pregnant. He was just like, is there any chance, he's this old Chinese medicine doctor, is there any chance that you could be this child, and like, what? No, of course not, and then like 2 weeks later, I go back to him, I'm like, how did you know I was pregnant? So can you talk a little bit about that?
So I actually am not good at that. It's supposed to be like a more slippery pulse. And I don't know if it's easier to tell when you've been seeing someone for a while and then you can see the change, but like I have not been able to like identify it myself, like to be completely honest with you. So, but yes, somebody like, and it is a lot of the older practitioners, like there are a lot of my, older like professors that would talk about it, and maybe it's just that I really haven't had enough people that I've seen like in that transition to be able to tell, but
I had been seeing him
they
for
can
some
tell
time,
right away just by feeling the pulse. Pulse is tricky. Pulse is hard to learn because there's so many different systems to like classify pulse, and then there's different things that it can tell you, and it just, it can be, there's like courses on just the pulse that are like weeks upon weeks and months long, so pulse is, I actually really kind of do enjoy pulse. So like it does bother me that I haven't like specifically felt that.
You'll get there though. You'll get there.
Some extra classes about it, but anyway, or on pulses. But yeah, it's supposed to be more slippery, which means that when you're feeling the pulse, it should kind of like move under your fingers in a different way. So
that is so fascinating. Like my mind was totally blown.
It's pretty awesome.
Yeah.
But it's just taking information from your body, right? That's what a little bit of what I think Western medicine has lost, you know, is taking like really simple little easy things to identify and not recognizing them as like something that could indicate something else going on, or like the beginning stages of something, you know?
So what would be some examples of that, Atalie? So like, you know,
well, like, okay, like kidney function in Western medicine, like your kidney has to be almost failing. I mean, I'm over exaggerating, but like, you know, like the labs that they test, like they have to be pretty bad for them to be like, oh, you know, this is bad, we can treat you now. And like in Chinese medicine, and I'm going to say this, and don't just, if somebody ever tells you you have kidney deficiency, don't immediately think that you're going into kidney failure, because they're not the same thing. But like, if there's something wrong with your kidney, like it's easier, like we can recognize it, I think, just a little bit faster. I mean, and some of it is interchangeable, like, you know, low back pain and things like that, or like more frequent urination or a change in urination, like things like that. But there are other symptoms too, like, you know, you could have more darkness under your eyes. You could have, there's just smaller symptoms that can tell you about something earlier on that, I don't know, I feel like Western medicine just doesn't utilize, you know? So, and
yeah, so like you're talking about under the eyes, like what about like the fingernails? Or
fingernails are liver. It's a liver blood thing, fingernails are. So like the lines are like cracking. It's nails and hair are an excess of blood. So you would be treating liver blood. Like if somebody, there's actually an herb called Hoshu Wu that people use when they have gray hair. And like,
that's what I need. Order me some.
You have to take it very consistently, but like, you know, it's supposed to make your, you know, make your hair, they give you more of the excess of more, well, I guess tonifies your blood, but also your kidneys. Cause like going gray is actually like a kind of a kidney deficiency. Like as we get older, you're born with so much essence, and like as you get older, you just kind of start using it up. So it's like a deficiency in that. So it helps build up your kidney too. So
oh, that's really interesting.
Yeah.
Wow. I can't wait till this whole COVID thing's over so I can make my first appointment with you. I'm ready to get my hair back. Get rid of these grays. That's awesome. So let's talk a little bit more about moms specifically, or soon to be moms like yourself. So how can acupuncture and herbal medicine really help a soon to be, or a mom that, or a woman that's trying to become pregnant, or that she is pregnant and wanting to have a smooth pregnancy and birth, and then moms that are already, that are breastfeeding and in the thick of motherhood?
Right. So, I mean, if you're trying to get pregnant, acupuncture and herbs, there are some great herbs to help regulate your menstrual cycle if that's part of the problem. Again, like you would be focusing on constitutional, you know, just anything that was like out of balance, right? Like the whole point of this is like to try and keep your body as balanced as possible, you know, like it's always changing and always moving, but like let's not let it get like this. Let's like kind of keep it right here. So needles and herbs to like help your your menstrual cycle. Same for men. Like I know men don't want to come in for anything like that, but there, you know, it's the same. There's definitely herbs and treatments that can help men as well. And then once you are pregnant, well, gosh, acupuncture is great, especially, you know, if you don't want to take herbs, it's fine. But if once you are pregnant, nausea, heartburn, backache, runny nose, headaches, like, I mean, gosh, there's so many things, like, you know, and then as you get further along, you could have hypertension, or you could have swelling, edema, all that stuff is stuff that, you know, we can help manage. So it's just a good, especially like if you can like go fairly consistently, I feel like it's more helpful because you can check those things before they get way out of whack, right? So, you know, the treatment I gave myself yesterday was more just to calm down. So like anxiety, you know, that kind of stuff. So
we could all use some of that. Yeah, absolutely.
Yeah, it just kind of depends on what is going on with you, really. But I mean, there's so many things, like you know, what else is there? Allergy.
Well, I'll tell you from my experience, when I was pregnant with my daughter and I was seeing the acupuncturist pretty regularly, I was going to take a trip. I was going on vacation. I was like 8 weeks pregnant and I was so nauseous. Like and I was so tired, like the fatigue was crippling and I was super nauseous. And I asked the acupuncturist, I'm like, look, I'm going on this vacation. I'm not going to be able to enjoy it because I feel terrible. And I was like, can you help me? And he showed me the ear. And I thought the ear, and then he like flipped it upside down and he's like, this is your womb, you know? And I was like, whoa, again, my mind was blown because the ear upside down looks like a womb with a little baby in it.
Yeah.
And then he gave me these little pin things that he stuck inside my ear that was supposed to help with nausea. And it totally did. Like it really worked. And he did a few other points that helped with my energy levels. And I was actually able to really enjoy that vacation.
Yeah.
So talk to us a little bit about what was happening there.
I mean, so there is a microsystem of your body on your ear, and it's like, this is like the head and the spine. And so it's like an upside down baby essentially. Mm-hmm. Right. So, yeah, there's, sometimes it's as simple as just finding a spot on your ear that's tender and like rubbing that, like it doesn't always have to be like, where is the specific point for this, but
okay.
internal organs, so there's so many different, like you can use your feet, you can use your hand. There's so many different areas of the body that you can use. I love ear points actually though. Like there's different protocols for ear points. They use them a lot actually in addiction. There's been like the NADA protocol. I don't know if you've ever heard of that.
No, I haven't.
Nurses and like psychologists will use it too. They've done trainings for them. And like, you can do that to someone and like, they just completely mellow out. Like it's just so much fun to see and experience. And so, yeah, it's just about finding the right points to help somebody's body do what it wants to do, like help it get better.
So it's going to be different for each individual. It's not going to be like a one size fits all kind of thing.
No, right. Okay. Which is why a lot of times, especially here, people don't like studies that they do on acupuncture because there might be like few specific points that they use, but then like if somebody's constitution is different, they might add this point. If this happens, they might add this point. And so it makes it hard, like here when we do studies, like if you can't reproduce it and do the same thing every single time, like they don't feel like it's valid.
Right.
Like the studies they do in China, like a lot of times people here are just kind of like, it's not a good study. It's not set up the right way, but it's not how the medicine practices. So there's always this like fight between, like you could treat a whole bunch of people the same way, but it's not what you would do in a normal practice. So is it as valid then? I mean, but yes, it's always going to be different. And different acupuncturists will use different points. There's different like point systems too that you can use. So like you might go to one acupuncturist and they might practice more Japanese style and it would be very like light, gentle needling. You might go to a more Chinese person and it's more of a, I'm just gonna call it heavy-handed, but it's like more direct, like stronger stimulation of the needles. And so there's different ways to practice and different points that they can pick just based on like what they're doing. So just because one person does one thing and another person does another doesn't mean they're wrong. They're just going about it a different way. So
okay.
There are people that come in and they're like, my acupuncturist does this every time. And you're like, I really don't think that that's necessary. Or, like, I don't want to do that. But like, they're so used to it because someone else has done it. Like maybe you'll, clearly I try to work with them. But sometimes people are so adamant about it. And I'm like, well, there's other things that we can do. You don't always have to do the same thing. You might not need that same thing every time. So.
Gotcha. Yeah. So part of going into acupuncture is having an open mind and being willing to, trust the practitioner and, allow them to really individualize your care, if you will.
for sure. I would say probably the most important thing when you go in for a treatment, you need to be comfortable. Like, if you're not comfortable, like, please tell me, or whoever is treating you. Like, don't just sit there and be miserable the whole time. You need to be able to relax. The more relaxed you are, the better the treatment's going to work. So if you're just like tense the whole time, like, you know, we talked about how chi needs to move. Well, if you're tense and tight, that makes it harder for it to move. So like, I don't know, I could put in a bunch of moving points on you and it might do absolutely nothing because you're so stressed the whole time. So just tell me. I never want to do anything to somebody that they don't want. I mean, there's always other options, always. Like, you can do Tuina, which is a type of massage. You can do acupressure. There's medical qigong, which is more of like an energy work. There's ear seeds instead of needles. Or sometimes if I have somebody who's really afraid of needles, I might just put seeds on points and like press on them and send them home with them so they can press on them themselves. If you are really scared of needles, what typically works, at least for me and my patients in the past, has been doing a face down treatment because the nerve endings on your back are more spaced out. So you don't feel things quite as much, right? So like, you know, I had one patient who I loved very dearly, but she was terrified, and we had this whole protocol. I'm going to call it a protocol. She would come in, I would put needles only in her back. She wore headphones, but only one so she could hear in case something happened, and one with relaxing music. And then as soon as I put the needles in, like we had discussed, like how long do they need to be in? And usually the minimum amount of time is 20 minutes. So I would set the timer for 20 minutes, come back in and check on her in 10 minutes, and then take the needles out in 20 minutes. It was like very specific because any more or less just, you know, and like once she got used to that, it was a lot easier for her to relax. So once she trusted that I wasn't going to do anything that, you know, was going to scare her, she could relax and the treatments work better. I also feel like too, once you start going regularly, your body learns like that this is what's going to happen, and it can relax. And so it gets easier and easier to relax. And then eventually you just pass out and sleep during your treatment. So
yeah. So for all those moms listening, it's a chance to take a nap, ladies.
Oh yeah, tons of moms. Like if there was an extra treatment room, like at my place here, I only have one room, but where I used to practice, if there was an extra treatment room, I would have moms be like, you can just leave me. If there's nobody like after, like just make sure I'm up by this time, but you can just leave me in the room. And yeah, I feel like moms love acupuncture because it is a downtime for yourself. You usually have more energy, you know, like it's a, yeah.
Yeah, absolutely. I can tell you from my experience that it has helped me tremendously in a lot of different ways. And, you know, for moms who are breastfeeding specifically, let's talk about some of the herbs that may be beneficial in either sustaining a healthy milk supply or treating a low milk supply.
Yeah, so again, the same thing, like depending on why that person's milk supply is low, you would prescribe different herbs. So like there are definitely some foods, like, you know, in China they make kanjis, like rice that you mix and you cook for a long time usually. And so there's definitely some kanjis, like a really popular one would be, at least it's the Xuan Mutang that I talked. Xuan Mutang is one of the herbs, and they use it with like pig's feet because pig's feet promotes lactation. And then soy sauce.
That's a new one. I hadn't heard of that one before.
Yeah, I mean, they use it in China a lot. Pig's feet is big there. And so they would put maybe soy sauce, peanuts, pig's feet. They do use papaya as well, and like fish basically. But, you know, it's going to be different based on what's going on. So if there's a blood deficiency, you would use different herbs than if somebody had a lot of excess heat and that was what was causing the problem. So like I can't just say that there would be one herb. And usually when we prescribe herbs, we don't prescribe one. It's usually a combination because it's about balancing a formula for somebody so that it's not too hot, not too cold, not too moving. Like you want it to be well, you want it to be specific to them, really, you know, to what's going on in their body. So like
Mm-hmm.
there's herbs that promote lactation that clear heat and infection in case somebody has mastitis or has just like swollen breasts or they're really tender. Then there's herbs that just move qi and blood, like if there was just stagnation. So I told you the liver goes through like your chest like that. And so liver qi stagnation is very common. It happens to most people. If you're irritable and sighing a lot, or like, you know, like anybody who gets really angry and like their face turns red, like that's like liver stuff going on. And so there's herbs that help soothe the liver if that's like part of what's going on. You know, if you're just bleeding too long, like there's herbs that can help with that. And because if you continue to bleed, then you're losing qi and blood and, you know, things like that. So it just.
So for moms that have recently given birth and, you know, I don't know what the typical number of days that you should be bleeding or whatever, like what is it, a couple weeks? But if you're it's going on longer than that.
If it's going on longer than that, then that would be an issue that you would, I mean, I would see your regular doctor and then I would go see your acupuncturist. I would do both because, I mean, there are, I don't want to like sound like I dismiss Western medicine because I think it's very good and great and very useful. And I would definitely want you to go see your medical, you know, more Western medical doctor. But then,
well, that's why they call it integrative medicine, right? So that you have all these different practitioners with different specialties coming at you at different perspectives and angles to treat like the whole person. So that's what I love about it.
And like, I just recently had a friend who started working in a hospital, which is like starting to become like, you know, more and more, it's happening more and more, but it's still not common by any stretch of the imagination. But I mean, they're starting to recognize, like even Medicare is starting to recognize it for pain relief instead of using drugs, right? So I think it's definitely, or hopefully, coming into more integrative medicine, because I feel like right now, you know, part of it is people just don't know what it can do. And then, there's a lot of people that think that I'm Buddhist and it's a religion, or, you know, that you have to believe in it. Like it's something, I don't know, magical. I don't know. And it's not like that. You don't have to believe in it. You can come in and I mean, I have people do that all the time. They come because I'm their last resort, or close to it anyway, and they tried everything else. And so they walk in and they're like, just so you know, I don't think this is going to do anything. It's not going to work, but here's my problem. And you're like, okay, well, lucky for you. You don't have to believe it's going to work. Granted, if you really think it's not going to work and you're not willing to like identify like steps in the process that are getting better, you might not recognize it. But most of those people after one treatment, not that you're going to be healed if your problem has been, you know, years long, but you're going to feel different. So, so yeah, you don't have to believe in it.
Just have to be willing to try.
Just like,
well, let's talk a little bit more about the needles, because I'm sure that there are a lot of people listening who hate needles and maybe just want to pass out at the thought of it. So are there different sizes of needles that you use? And talk to us more about the little seeds that you were describing.
The ear seeds are actually little tiny seeds that are on a piece of adhesive of
like glue,
adhesive, whatever.
Oh, okay.
Which, even though it's supposed to be medical, like the adhesives on all that stuff tend to bother me after a couple of days. So if somebody ever puts ear seeds on you and it starts to get itchy, just take them off, because it's not worth keeping them on. I always put new ones on after a couple of days, but the seeds are actually seeds. And then they do sell like tacks that are also on those adhesives. And so they're little tiny little needles that you can actually like press into the ear or whatever points you want. So they're different. And you can get seeds or ear, like they're seeds that are actually maybe made of like gold or different materials that are supposed to, you know, maybe tonify or reduce something differently. But most of the time they're actually just these little tiny, they look like little poppy seeds. Super tiny. and then you can press on. Like once they're on, it's supposed to continuously stimulate that point. And then if you did get more stressed or you were more nauseous, you could press on it again to kind of like reactivate it, or, you know, make it more intense or stronger. Needles themselves, of course, they come in different sizes. They come in different like gauges and sizes and whatever. They're nothing like you picture when you picture like a needle and you're getting like a shot or an injection. They're solid. Nothing comes in and out. They're all disposable. They're one-time use. They come in sterilized packages. They're like a strand of hair. I mean, they're really tiny. The only time you'd have a bigger needle or a longer needle is when you're on like kind of more meaty parts of the body, like somebody's like glute or something like that, you know, like the points there's just more muscle there. So if you put in a little tiny needle, it's not going to get to the point. So there are longer needles for certain spots, but most of the points, if you have an acupuncturist who's trained, you're not going to get hurt. Like it's very safe. You know, you might feel like when the needle first goes in, to be honest with you, I don't like it when people say that it's not painful, because I feel like everybody experiences pain differently. And I don't like blanket statements like that, you know, because what I think of as like a sign of chi, somebody else could think of as pain. So I don't want to like dismiss anybody, but you know, when you tap a needle in, there's usually a guide tube. So you hold the guide tube to your skin and the needle is just a little bit longer. And so once the guide tube is there, you tap the needle in and it's supposed to go in through the first couple layers of your skin so that it isn't painful, right? And once you get through those first couple layers, it's not supposed to really hurt as much.
Okay.
You can still feel stuff, and that's okay. And sometimes that feeling of like when you actually get chi, or you feel like the needle has kind of like activated that point, there can be some really strong sensations that people feel. I happen to love them. So like to me, if I don't feel a strong sensation, I feel like I was gypped out of a treatment. So everybody's different. So if somebody is really uncomfortable with those feelings, then you can use smaller, thinner needles and just not stimulate as much. And so there's different ways you can kind of adapt the treatment to the person. But yeah, I think that was a really roundabout way of answering the question, but I think
yeah. So okay, so they're so the needles are really tiny and they're not meant to be painful, and usually once you get them past the nerve endings, they're comfortable, like you can't even really feel them.
Once they're in for a little bit, you usually don't feel them. So like I call them zingers, and they're usually points that like you really need, like points that you should really be needled on your body. And you might feel an electrical stimulation, or like you might feel stuff moving when they first go in, and all that should subside pretty quickly. So if somebody puts a needle in and it doesn't subside in like, I don't know, 30 seconds, you know, a minute, you just tell somebody, because it could be as simple as just like moving the needle a little bit and you'll feel completely fine. They're in between muscle most of the time. So like, let's say you put a needle in and then you kind of adjusted or moved a little bit, you might feel that because your muscle moved and it's in between. So you might feel a sensation then, but once you stop moving, it usually goes away. Then again, if it didn't, you would just tell somebody and we'd fix it, because it's really easy to fix. So yeah, you just need to be comfortable, you know, like, yeah, you might feel something for a little bit, but it should go away pretty quickly.
Okay. I know for me, when I've had it done, I think that my personality, or maybe just the way that I process, I tend to get a lot of blockages because my emotions, right? Because I worry and I get stressed out. And
I think that's just you.
Okay, yeah. So probably most people listening have similar situations. But I know when I would feel the sensation, I would get a little bit hot and a little bit sweaty, and then it would go away. Yep. I mean, it wasn't like uncomfortable or painful. It was just like something opened up and blood flow started flowing into that area.
I mean, that is what happened, right? So you had a stagnation, and I don't know if you've ever felt it, but sometimes on me, when it's really bad, I can actually feel like like it's trying to move through like circulation or chi or blood or energy, right? And like it's kind of stuck, and then all of a sudden it opens and I can kind of feel it like spread everywhere then, right? But yeah, no, I always sweat during treatments, like you said, like the needles go in, you start to relax, get a little sweaty, and then fall asleep usually. So that's pretty common.
Yeah. Yeah, that's really interesting how the body responds, you know, when things start moving the way they're supposed to be moving.
Everybody's a little different, but yeah, pretty common to sweat just a little bit after I'll go in. And yeah, people having problems because of their emotions, that's all of us. Like that's anybody.
Yeah, well, talk to us a little bit about how our emotions really can manifest in a lot of these physical symptoms.
Yeah, so I think we talked a little bit about the liver. So the liver is associated with like anger, frustration. So if you're feeling more, like I said, frustrated or irritable, sighing a lot, I think sighing a lot is like one of the big key liver chi stagnation symptoms. Like you'll have a patient come in who's you're talking to and they'll just be like, you know, and like you see kids doing it all the time and you're just like, you have some liver chi stagnation. And like, you know, there's different things like the pulse will be wiry. There's different things like that, but like, you know, yeah, sign is a huge one for liver chi stagnation. Heart issues, like heart emotional things, like it relates to kind of more anxiety type things. So like palpitations, you know, it can relate to like if you're having more of an attack, it could be like, you know, you have trouble breathing or things like that, right? Which, I mean, you know, breathing relates to the lung, but it's when you're having an anxiety attack, it's more related to your heart in that respect. Gosh, spleen is worrying. So if you have like some spleen emotional things, it would be a lot of worrying and worrying, fretting, just like that constant, spleen things tend to feel kind of like heavier, more depressed too. So like you could feel, you know, maybe a lack of interest in something or just, like, you know, things like cycling through and you're worrying about the same thing over and over again. What else is there? Kidneys, fear. So lots of, and so like, yeah, fear is the emotion that kind of is connected with kidney, but, you know, your kidney could be low back pain. It could be the bags under your eyes. It could be knee pain actually is, knees relate to kidneys in Chinese medicine. So there's different things that could, you know, signal kidney. Like a lot of times when people come in, I ask them how they experience stress because everybody is different and like how they experience it in their body, right? So like people will be like, oh, I get anxious or oh, I get this, but they won't necessarily always be able to tell you like physical symptoms that they experience. And like, you know, some people might just get like the muscle tightness, you know, and that can be, you know, that can be kind of liver stagnation, just blocking the flow of chi. But, you know, you could have a spleen deficiency that's affecting your muscles a little bit too. So there's different ways of looking at it basically. But yeah, all the main organs kind of have an emotion related to them. So that's kind of like your go-to when you're starting to see somebody, if they're like, you know.
If a mom comes into your office and she's experiencing fear and worry, maybe she's pregnant, maybe she's worried about the pregnancy or the delivery or whatever, would you typically, you would do a treatment, you would do an acupuncture treatment, and then would you also prescribe herbs as well, or do the herbs not always go along with the treatment?
It depends on what somebody's coming in for. A lot of times when somebody is feeling emotional things, I do like to prescribe herbs, just because I think acupuncture and herbs works together really well. There are some things acupuncture is better at, and there are some things herbs are better at. But like they work well together. So if I can, I, you know, usually do. But it also depends on the person. If somebody's not going to take herbs because they don't, I mean, they're just people that never want to, you know, then I'm not going to give you herbs because it's not going to help, and it's probably going to stress you out more. Yeah, for a pregnant mom, I might do more food therapy rather than herbs, just because, like I said, a lot of people don't want you taking any herbs during pregnancy. And so I mean, it's going to be based on what that person is comfortable with. I love ear points for emotional things. Like, that's what I do. If my husband is really upset, like, let's maybe put in some ear points for
Okay. So when you were talking about the liver anger stuff, so my oldest son is 12, almost 13, and he's got the hormones and everything, and he does get those moments of where like he's so angry and his face gets all red. So do you do acupuncture on children?
Gosh, I love treating kids because I did the ABA therapy with my autistic kiddos. Like, I love kids. I know that this is my first kid and I don't have any of my own yet, but like, I love working with kids. Kids are so straightforward, like, in a brutally honest sort of way sometimes, but it's sometimes easier because you don't have to like parse through all this like stuff that people are like holding back, Kids are different, like, so depending on the age, like infants, you would do pediatric tweener, which is like more of a massage thing. And like, so if you came in with an infant, I might do a little bit and then show you how to do it, so that you can go home and do that for your child. There are herbs you can give kids. There's specific like formulations too from different companies that are tinctures so that you can like, give it to somebody really small. And they usually use like, I think like glycerin or something instead of alcohol in case, which if you had a tincture that had alcohol, you could just put it in some hot water so the alcohol evaporated and it would be fine. But most people just would prefer something that doesn't have any alcohol whatsoever. So there's specific lines of pediatric formulas that you have that are, made with kids in mind. So they don't have some of those different things that, you would not think twice about giving an adult. So yeah, like if the kid is afraid of needles, then I mean, you kind of work with where they're at, so it might be more acupressure. It might be teaching them points they can press on when they're feeling that way. Food, herbs. But yeah, no, I like kids a lot. I like treating kids. They're fun. It's fun to like have kids like feel something and then kind of get excited about it, I mean, yeah.
Okay. That's good to know because, I think that we as moms, we're willing to maybe be the guinea pigs for things, but maybe we'd be like, I don't know, like with the chiropractor, right? Like I'll go to a chiropractor, but I don't know if I want to send my kids to the chiropractor, all these things. But it's good to know that you not only feel comfortable and that you're able to work with children, but you actually really enjoy working with children.
I like it so much. Yeah, I like one of my goals for the business is to be able to have like a pretty good pediatric like practice itself. I don't ever want to say that I don't want to treat any one thing because like all these business stuff that I'm doing with We Venture, it's like, who is your target audience and all this stuff. And it's like, I don't want to pick any one thing because I'm treating different things, but like I would like to treat a significant number of kids because I just like them. It's fun.
That's good to know. So you could potentially be helping moms whose babies have colic or, maybe difficulty sleeping. And then you could be working with kids who have allergies. And then
like I had some autistic kiddos that I was treating in San Antonio. Like there's just different, I mean.
And then like in my case, preteens and
yes,
teen hormones. We need a lot of help over here in this house. I've got a toddler, a 10-year-old, and a 12-year-old. So I've got my toddler who's like going on 13 sometimes, and then my 13-year-old who's going back to 3 years old sometimes. And I'm like, get me out of here someday.
Because I said I'd send you those points. I'll send you a couple points for some liver cheese stagnation too.
Oh, good. Okay, that would be fabulous. Yeah, we need a lot of liver and spleen for me and some heart stuff, and we need it all. But being a mom and you going through your pregnancy, as and it will just continuing. It's the hardest job in the world because all of a sudden. Not only are you trying to take care of yourself, but then you're trying to keep this little human alive and healthy. And, you know, there's all of these different variables to it. And it's as moms, we need to have as many tools in our toolbox as possible.
Yes.
So I'm so glad that you came on today to talk to me, because now the moms listening can add you to their toolbox, and they know that you're a mom, that you have experience working with kids, and that you know all about, you know, infertility stuff, the pregnancy stuff, the breastfeeding stuff, the motherhood stuff. So all of that is comforting to know that we have one more person in our corner that can help us get through.
I'm all about more tools in the toolbox.
Yeah.
I would love to be someone's tool.
Absolutely. Well, you're definitely mine now. So as soon as this whole quarantine thing is over, you'll be seeing me in person for sure. And maybe my whole family. I don't know. We might just all show up.
So there's one thing I would say is that acupuncture, or like actually herbs are probably what I would use, but like if you have allergies or cold or something like that, people tend to cancel their appointments, and like that's a moment where you should come in, because we can help kind of like cut the duration and like give you herbs to help. Like I've been giving my husband herbs so that he doesn't get sick, basically like preventatively, right? And then if he does feel a slight tickle in his throat, there's another formula that he now knows. He's actually pretty good with some herbs, right? So like if he gets a tickle in his throat, then he switches to that formula. You know, like there's stuff that we can do that people kind of don't think about, because you think about pain and like, you know, stuff like that. But yeah, if you have a cold, sometimes you just need some good herbs and feel better pretty quickly. So like I really don't get sick that often, because if I do, and even if I always tell my teachers, if you're around somebody who's really sick, like keep this herbal formula in your drawer so that you can just take a dose and like, you know, kind of proactively prepare your body, or like, you know, so that you don't get whatever somebody else might have.
Right.
So
give yourself that little
for families, especially like when you first start going to daycare and everybody's sick for however many years or however long that takes, right? Yeah, there's definitely some helpful things you can do. That I send herbs to my sister all the time. So.
Is she a teacher? Or
she's not, but her kids are in daycare. So
oh, okay. Yeah. Well, I was thinking about something as you were talking that I thought was really important. Well, that's it. COVID. We were talking a little bit about COVID and how you're doing stuff for your husband to protect him. And, you know, obviously this is like not medical advice. This is just education. Like nobody should like, you know, you obviously want to talk to your doctor about everything. You got to go through that whole spiel, right? But what are some things that as moms we can be doing in your mind that can help protect our families from getting sick?
Yeah, so anything that can kind of bolster your immune system, you know, which there are some points you can use to, you know, help your immune system, but like, you know, even getting sunlight and getting enough sleep and like all the really simple things are actually, you know, part of what I would tell you if you came in, you know, eating good foods, you know, making sure you're getting a lot of greens. I feel like greens are the hardest one for people to get a lot of the time. But, you know, like
is there a specific point that maybe we could even use? Like you were talking a little bit about the lungs and maybe a point up here.
If I was gonna just tonify someone's immune system very simply, I would use stomach 36, which is on, let me see, I'm gonna go grab my AcuMan and see if I can show it to you. Hold on.
Okay. So while she's gone, I'll just do a little chat here. I want to tell you, in my experience with acupuncture and the people that I know have done acupuncture, it really is quite incredible. I've known quite a few, I'm talking to our audience while you went away, but I know quite a few moms who were dealing with infertility issues, and, you know, we're like, go get some acupuncture, and, you know, they consistently you know, end up getting pregnant through that process of seeing an acupuncturist, which is really quite incredible. I mean, I know a lot of women who have that same story. So go ahead.
Yeah, no. So it's stomach 36, which you can Google and find out where it is pretty easily. Let's see if you can actually even see. So it's kind of below your knee. There's a little
Okay.
like kind of under your knee if you slide up from your shin, and
Mm-hmm.
it's basically kind of level with that little protuberance there, but right there is stomach 36. So if you Google it, you can find it. But that point is really good for so many things. If you had moxa, you could moxa that point to stimulate your immune system too, which is like really cheap, really easy. Like, you know, I think, you know, a moxa stick is like $2, and I think you can even find them on Amazon or something like that. And it's pretty safe, except if somebody has a lot of heat. So like, I would definitely talk to somebody before you did it, but like, that would probably be like one of the number one things that I would do just to stimulate the immune system. There are points on your back you can do too. I mean, there's a lot of options, but that would be like my number one. That would be like stomach 36, press it on both sides. It should be tender. If it's not tender, then you're not in the right spot.
Okay.
And you might need to press pretty hard. But yeah, I would use stomach 36 a lot.
Okay. All right. Good to know. One extra tool in our toolbox, mamas.
Yeah.
Stomach 36.
That would be my go-to. I've been moxaing actually my stomach 36, so.
Okay, good for you. So yeah, the experts doing it, you know, it's the thing to do.
I was actually really worried when I first got pregnant. Well, when I found out about all this COVID stuff, and I was asking a different herbalist, like, you know, about what I could do. And she was like, I just remember being so like dismayed because she was just like, stay home and tonify your wei qi, which is like your immune system. And I was like, okay, all right, that's what I'm going to do. So
yeah, so that's what you've been doing. So will you, do you kind of have a plan set in place for getting back to business?
Yeah, so, and I've kind of been toying with, because everybody's been doing, you know, online, like, you know, like this with patients so that they can like give them herbs and things like that. So I've sort of been toying with it. So like, if somebody was really interested in some herbs or just like maybe an acupuncture point prescription, like assuming that like you filled out the health history and like I talked and felt comfortable with the information that you were giving me, I would be willing to even do that right now, really. But I just haven't actually like set that up, right? So, but I know that a lot of my friends who work for like bigger companies are using Zoom actually to do it. So there's so many options out there, but so that would be, so that's probably going to be my next step. And then I don't know, as far as feeling comfortable treating patients, I feel like I'm slightly more apprehensive to do in person until things are better, just because I am pregnant.
Right.
If I wasn't pregnant, I would be way less apprehensive. But right now I do feel like I want to be a little bit careful. So like, I think my first step would probably just be doing some online consultations and giving some people maybe some herbs and like point prescriptions. So.
Okay. Good to know. So when all of this blows over and you are back in business, where can our listeners find you, or how can they get a hold of you?
Yeah, I have a website. It's changingelementsacu.com. And then I'm in Indialantic off of 5th Street between Skewers and CVS, essentially. There's a business condo there. The sign on the street, I think, has like an insurance company, and then Balance Bodywork, who is the person I rent a room from. So that is what you're looking for. And it's easier to get in from behind than it is from the front.
Okay, so go behind the building then.
Yeah.
All right, awesome. And do you have an email address that you would be willing to put out there?
Long. It's changing. It's on the website too, but it's Changing Elements Acu. It's at secure-mail.com, and it's SECUR. So it's
I'll put a link to that here. And your website and all of your information, so that if people want to reach out to you and maybe set up a virtual appointment or you know, connect with you and see if you would be a good fit for whatever they're going through, that would be amazing.
Yeah, that would be amazing. I would love to help. So.
All right. So congratulations on your pregnancy. And we wish you all the best in the world with your new little one. Are you sharing the gender of the baby? Or are you going to wait to see what it is?
Nope, it's a girl.
It is a girl.
It's a girl, yep. And then everybody asks if we have names, and we have like no names. So I would say it might be a family tradition to not have a name for the baby right away.
Yeah, that's okay. That's cool. You might just have to wait until you see her until you decide, what's the best fit.
Yeah, like I might need to I have to meet this little individual that, we created in order to be able to feel like confident with a name. I think about, the only things I've named are my pets. So I don't have a lot of experience like naming something, right? But I feel like somebody called it like the first gift you give your child. And I was like, it just feels like such a big responsibility. So I don't know.
Yeah, the name that they're going to have for the rest of their lives.
Yeah,
right?
and I mean, my name is Atalie. And when for the first 10 years of my life, I hated it because people called me Adelaide and Natalie and like all these different things. And like there was a kid in elementary school who would call me Adelaide Italy or something. I don't know. I hated it. I told my mom I was going to change my name right away. And then as I got older, I was like, I really love my name. It's just like kind of different,
Yeah.
So I'm like, I kind of don't want somebody to have to go through that. But at the same time, now I really like my name. So maybe it was worth it. I don't know.
Yeah, I don't know. My 3 kids are named after pro surfers, so I'm not a good person to ask about names. My parents wanted us to have, awesome meaning biblical names for all of our children, and they're all named after pro surfers. But their middle names are biblical, so that works, I guess.
There you go. I mean, but it has to feel right, so.
Yeah, exactly.
I'm sure we'll figure it out. But
you will. It'll be beautiful.
And we're just like, nope, sorry.
All right. Thank you, Atalie. And I'll put all of your information connected with this so that people can reach out to you if they want to learn more and get to know you a little bit better. But I appreciate you popping on with me today and teaching us what you know.
Thank you. Thank you so much. I really appreciate you asking me. So thank you. It was fun.
Bye.
Bye.